The ketogenic diet is a high-fat, low-carbohydrate diet that works by dramatically reducing the amount of total carbohydrates and increasing the amount of healthy fats consumed. This shift in macronutrient intake causes your body to go into a metabolic state of ketosis, which is when the body begins to burn its own body fat for fuel instead of carbohydrates. The keto diet has been proven to be an effective way to lose weight and improve overall health, according to research. Studies have shown that it can lead to a significant weight loss, better blood sugar control, improved cholesterol levels, and reduced risk of heart disease and certain types of cancer. It can also help with mental clarity, increased energy levels, and reduced food cravings. The keto diet, unfortunately, is not for everyone. It can be difficult to follow and requires a significant commitment to stick with it. Additionally, some people may experience side effects such as constipation, headaches, fatigue, nausea, and other unpleasant reactions. Those considering the ketogenic diet should consult a healthcare provider to ensure they are healthy enough to even follow the diet and to monitor them while they do so.